and statements made by the host and participants in this program are not those of the owners, advertisers, and management company of Sugar City FM 90.3. Nor are such statements necessarily supported or endorsed by the owners, managers, or advertisers of the station. While we encourage all to share their opinions, we do not support any comments that may slander, discriminate, or otherwise offend anyone, and we insist that you refrain from any such statements.
Fellow citizens, near and far, join Newrish Nital on Sugar City 90.3 for Fear No Favor.
Where is the cancer and the world that come out for war?
Tune in to 90.3 on your FM dial. Log on to SugarCityFMSinkits.com or download Simple Radio app on the Google Play Store. And join Newrish Nital every Thursday night from 8 to 10 p.m. as Newrish Nital tackles the issues and take your calls. Fear No Favor every Thursday night from 8 to 10 p.m. on Sugar City 90.3 FM.
Welcome to Fear No Favor with Dr. our good surgeon, Natalie Osborne. Doc, how was your week away from this studio?
My week away from the studio?
It's been a week since we last met.
Oh, yes, we were here. Not last week, the week before. The week was productive.
So
Good.
2 weeks.
Yes, it was wonderful.
Any major challenges?
Yes, there are always challenges, but we get through them. Yes, I got through them by the grace of God. So it's good to be here again with you this evening. So how was your day?
Hectic.
It was
I was
hectic.
busy doing a forensic report,
Oh,
trying
good.
to assist somebody with something.
Excellent. It's important to keep occupied, gainfully occupied.
Of course.
And always learning. I know you love learning.
Never stop. Yeah, so today we are going to talk about abdominal wall hernias. And I think that is a very important topic because some people, when they think about hernia, most of the time they think about by the navel area. Mm-hmm. And I know that I have a son who used to suffer from hernia. And it is amazing what I was told to do. And he has recovered since. Most of the time the hurting used to come on just after eating. Uh-huh. So I don't know if something would have gone into that hole that would have been created and he had to take something like squats. But we'll get to that. It'll be a very important session tonight, and I hope those of you who are listening, of course, you can call in at 466-0903 and be a part of the conversation. We have now designed a program that the doc, very, very busy person, would spend an hour with us, and then I'll take it from there to other topical issues. And one such topic would be water. It's World Water Week, and I want to make a contribution to that. So upon completing our session, first part of our session with Dr. Osborne, then we'll move into that. Okay? So, Doc, good night.
Good night.
What is a hernia?
Well, a hernia. Well, it's good that you said that you're pleased with the topic that we chose. Maybe if I knew that it was water week, you said it is, I would have spoken something about water, the importance of water. But that could be another topic for another day. So we're going to be talking about abdominal wall hernias. And why I specified abdominal wall hernias, because there are different types of hernias. There are hernias that are also internal hernias, that occurs on the inside of the tummy, of the belly, and there are different hernias associated with the stomach. But today's focus will be the abdominal wall hernias. What do I mean when I say the abdominal wall? That is that your tummy or your belly that we see there, all that wall, because that wall is a whole layer where you have the skin, fats, and the different layers of muscles before you get into the belly or into the abdomen, scientifically named. So what precisely is a hernia? Because we have this protective layer that is called the abdominal wall, or that wall there, that tummy that we see, that is responsible for protecting and shielding the organs that are inside. And that wall has a layer that's called the fascia. The fascia is nothing more than just the muscle tendon sheet, but once it's on the tummy, they're flattened. And these come together in the midline. Do you see sometimes just there by your navel? That entire thing that runs from below your breastbone right down over your pubis or over your groin area, that there's a midline there and it fuses together. And oftentimes during the development as a fetus, as a baby, before it comes out, there are different abnormalities that occurs there, and there could be a weakness. So a hernia is nothing more than a weakness or opening in the abdominal wall where the content that is inside pushes through that defect. So there's a small opening, or it could be varied in size, and in that opening, the content that is inside, sometimes it could be fat or bowels, and it goes inside the opening and it goes in and out. And sometimes it even becomes pinched there. So a hernia is nothing more than a defect in the abdominal wall that allows the internal organs or internal structures to come through that defect.
Do they just slide through there, or you have some sort of force that would have to be operative for them to come through that affected area?
Of course, good to ask that. Good of you to ask that question. Usually, anything that increases the pressure inside of the tummy, that we call the intra-abdominal pressure. So if you cough or sneeze, you increase the pressure that is inside there, and if there is that opening or that defect, the content will push it to. Okay? And that will increase it. So anything that maybe you cough, maybe you sneeze, maybe you lift something heavy, and that will increase the pressure that is there.
Well, sometimes when you do that and it happens spontaneously, though, you're not on your guard. But for example, if you're doing abs, you tend to tense your abdominal area. Would it still happen that in that manner when you would have tensed and be prepared to put pressure in that area, or it is when it catches you off guard, it will go through that defected area?
As I said, again, once you have that defect or that opening, when there's an increase in pressure, the content in there is looking for a place to escape or to go through. And anywhere there's a weak point, it's going to slide through there. So if you're doing abdominals, you're doing sit-ups, it can happen as well because you increase the abdominal pressure, the intra-abdominal pressure.
Okay, great. What are some common hernia locations?
Okay, as we speak about the abdominal wall hernias, you can have one in the area that we call the groin, that is down there by your private part, where you have the pubic hair, just off to that side. That region there is called the groin, and you can have hernia there coming to that area. Okay, you can also have a hernia anywhere along the midline or the line that comes together, as we said earlier, where the navel is. You can have a hernia at the level of the navel or the belly button or the umbilicus. You can have a hernia above that area as well, that you call a supraumbilical hernia, that is above the navel. You can have a hernia even below the navel as well too. All right, and you can also have a hernia as a result of a previous surgery. So for example, you would have had a surgery for, let's say you had a laparotomy, you had some sort of major surgery where they cut through the midline to repair something. It could have been as a result of a traumatic event, and after you had that repair done, you develop a hernia at that site.
Would that be indicative that maybe the surgeon did not do a thorough job in having it sutured properly, tightly enough?
No, that is not specifically so. That's as it's called, an incisional hernia. It can occur after an incision, after a previous surgery. It can be, it is multifactorial. It can be as a result of factors by the patient, factors by the technique. If the patient is obese, they're at a greater risk of developing a hernia. If the patient has some form of immunocompromised state, if they're diabetic, if they're immunocompromised with HIV, anything that causes a change in their body, they're malnourished, that person can develop a hernia. And there are technical faults as well to that would predispose or would allow a person to develop a hernia. It could be you didn't have the right surgical material, for example, the technique wasn't done most adequately. It can also be if you had after you had the initial surgery, you had an infection there at the site. A wound infection leaves a high risk of developing a hernia.
Let me put the record straight here, because sometimes some persons feel that only males will experience hernias because they're generally associated with the lower back by the testicles.
Mm-hmm.
Could we talk about some of the different types of hernias and whether or not it can be equally impacting on males and females?
Okay, some of the common types of hernias on the abdominal wall, we said the hernia in the groin, that is called an inguinal hernia. I'm sure many persons would have heard about an inguinal hernia. Another hernia that is right there just below the inguinal region, or where the thigh meets the body, just in that region, you could have a femoral hernia. Some persons must have heard about the femoral vein, the femoral artery, just right there below the groin region, just in the crease there. That is called a femoral hernia. You could have an incisional hernia, as we said, that occurs after you've had a previous surgery. You could have a hernia by your navel, also, which we call an umbilical hernia. There's also hernias above the navel, that's we call supra-umbilical, because it's above. Supra always indicate above, or sometimes if it is a little bit higher up in the midline, we can even refer to it as an epigastric hernia. That's a hernia that lies just over the stomach region on the abdominal wall. So there are many different types of abdominal wall hernias.
That one down in the groin area, especially common in men. Sometimes when you're young, coming up, you would see an elderly person with quite a load in that area, like an increase in volume of the testicles. Is that an example of a hernia reaching down as far as the testicles? Is that possible?
Yes, that is quite
You
possible.
used to call them bamonku.
Yes. You said it before I did. I'm happy that you said that. And you would often see these men wearing really big clothes and big pants in order to conceal that hernia. So yes, that is usually as a result of an inguinal hernia, because an inguinal hernia right there in that groin region is very common in males. And why is that so? Because during development inside the female's tummy, during the pregnancy and the fetus or the baby is growing, the testes develop inside the abdomen, or we call them locally the ball. They develop inside of the abdomen, and during the development they then move from inside of the abdomen through the abdominal wall and go down into the scrotum. So it's following a pathway from inside of the belly and go down into the scrotal sac. And sometimes that opening, as the testes pass along that tract, it doesn't close off completely. And that is what leads to a hernia. And so the content, or what is inside of the tummy, can then slide down into that region and go down into the scrotum. And as time progresses, if it is not treated or taken care of surgically, what happens? It becomes wider and wider, the opening or the defect, and more of the content or the stuff that is inside of the tummy goes down into the opening, creating a large hernia. That is what we used to, was referred to as a bamonku, or the correct scientific name is a inguinoscrotal. So it goes from the inguinal region above the groin down into the scrotal sac, or the sac that the males have there, and it fills there with the content. Oftentimes it is bowel, it can be the bladder there, it could be the colon, and it fills up that area. And as the opening or the defect becomes wider, more content goes down.
That is very interesting. Very, very interesting. I know some persons. I had a male athlete friend of mine, and he had one testicle. Apparently, the other one just did not come down. And I'm wondering if the opening would have remained there, or maybe it got closed up before the other one made its way out of the area down into the sac where it's supposed to be. He had just one testicle.
Well, that is what we call, that's a separate diagnosis. That's an undescended testis. Okay? We said that the testes begin or originate from inside of the tummy, and then they descend or follow that pathway down to the inguinal region or to the groin, and then down into the sac, which is called the scrotum. So sometimes if there is an abnormality or something went wrong during the development of the baby, it stays up inside of the abdomen, or sometimes it's stuck inside of the groin, but it never gets down into the scrotal sac or into the ball sac there. And that is what we call an undescended testis, but that is a separate entity than a hernia itself.
I don't know hernia itself. Because you would have had situation where females would have had the uterus outside of where it's supposed to be. Is that an example where there might have been a defect and the uterus would have made its way outside? Like somebody might have been making a baby and somehow uterus happened to be on the outside, and doctors would say, well, we have to just abort that baby because it would not be too healthy.
Well, for the uterus to be on the outside, it's usually associated with a lot of congenital or genetic defects, right down to the chromosomes. And most of these defects would include that the wall of the abdomen doesn't close correctly, and then that usually leads to some major abnormalities in the development of the fetus, which makes it oftentimes incompatible with life.
Is it just a swelling? Is it a swelling that hurts when it is extended down into the sac for the testicles? Would it hurt?
Yes, it
Would
can.
it just a second? Would it even get bigger? Does it grow once it reaches down there? Would it continue to grow? Maybe get some nutrients and continue to grow?
What exactly?
The hernia down in the testicle area.
The hernia is a defect or opening. Imagine you have an opening like this on the abdominal wall.
Yes.
So it's nothing more, nothing less than the opening. But the content or what is inside of the tummy goes into that opening and goes downward. And over time, if the opening continues to extend, more content from inside the tummy goes down, okay? And then that content can become trapped or closed off and inside of the opening, leading to pain and different associated complications.
I have never heard somebody say, well, he used to have a bum uncle. It is always that he has. Can it be corrected? Can the extended testicle area be corrected by surgery?
Yes, it can be corrected. It can be corrected. So once you have that opening or the defect, the simple surgical understanding for our audience is that you want to go in and close down that defect and put back the content inside and close it off so that the content or the intestines, the bowels that are inside the tummy would no longer protrude outward.
Maybe it would have already started to go through either meiosis or mitosis and expand down there and attach itself maybe to tissues, and so that they're not supposed to attach themselves. So I'm just thinking sort of awkwardly, knowing that it's down there and content is going down there. And of course, once you have blood vessels and nutrients, the possibility that the cells them could multiply and create quite a problem.
It's not so much the cells are multiplying. It's developed already. So you may have down into the sac, you may have fat tissue, you may have the bowels, and they go down there. And if they're allowed to stay down for a long period of time, then it can become stuck there. But there isn't, not essentially, there's any cellular changes per se in that. Is that the content or the bowels that goes out into that sac, it gets stuck down there. Okay.
And it cannot become carcinogenic. It cannot become cancerous.
No. A
cannot.
typical hernia would not become cancerous.
How common are hernias?
Well, common hernias are very common. Okay, It's said that in the United States, about hernias, 75% of all hernias occur in the inguinal region. It is very common. 20% of all hernias are umbilical hernias. 25% of them are inguinal hernias. Inguinal hernias are the most common of all these hernias. You get about 10% of hernias that can be incisional or after a previous surgery in the abdominal wall. So they're quite common. One of the most common surgical procedures, actually, that is done electively.
How
To
could,
repair them.
yeah, how can one recognize a hernia? They always protrude, yet they'll go through the opening, but do they always come out and manifest themselves on the external side of somebody's body, like the one down in the testes? You can see that, but there are others that would stay within. Yes, they come through the hole, but stays within the body still, so within the abdominal area.
Okay, so we have the hernia opening.
Yes.
I want you to make sure that our audience understands. That is that defect that is in the abdominal wall, but it's covered by the skin, it's covered by fat. So it has those layers occur. So the opening is there and the content pushes through. Once there's a defect, anything that is inside within that area where the hernia is, it can push through there and stay inside there. That you have to keep in mind. That is essentially what a hernia is. And once you understand that concept, you think. So it is just whatever that is inside the abdominal cavity. Once there is an opening, the content is going to find a way out through that opening.
Is there always a swelling to see something like the one in the
Yes.
females?
Yes, so there oftentimes it would present with a swelling. That's the most common physical sign that you have a hernia. You see a swelling. The person would come and say, Doc, when I was working out, doing my exercise, I saw a swelling there. When I coughed, I saw a swelling. All right. When I sneezed, I saw a swelling. Because oftentimes anything that increases the pressure on the inside would push out the content and create this bulge that you would see.
Okay. And hernias could only be down in that area. There cannot be anything above the shoulder, like in the neck where you have a swelling because you might have had a weak or defect area somewhere there.
No, hernias are not very common up in the
shoulder
in the
area.
shoulders there. Most of the hernias we know can occur in the abdominal wall. There are different types of hernias, but these are the most common ones. There's something that's called a hiatal hernia. That's a defect in the diaphragm. That is that wall that separates the chest from the tummy or the chest from the belly. But that's a different type of hernia.
When people hear hernia, they like to panic. But most of them used to see hernia as just down in the testicular area. How serious is a hernia?
Well, a hernia, not to scare our audience, a hernia most times aren't that serious, but it can be. Though it is very common, as we said, it's the defect that's there. Sometimes the defect or the opening is quite small, and the person can go along with it for many years. But what can happen over time, that person may have gotten pregnant, and anything that increases that, and as the tummy expands, it can make the opening or the defect larger, and then it can become serious if the content gets inside of the hernia sac or inside of the defect, and it gets trapped or squeezed there, and then it become stuck there, and it can become very painful, very uncomfortable, and it can lead to complications if there is damage to the blood supply. You may have some complications there, because what? For example, if you have the bowels go inside it and the bowels is squeezed off and the blood supply is affected, you can then have more serious complication.
What are the symptoms of a hernia?
Most of the symptoms associated with a hernia is that you're going to see a bulge. Most of the times you see a bulge, the person can have some pain, some discomfort there. They can have some, like a dragging sensation. They can have a pinching sensation oftentimes, a dull ache. But most of the time, the telltale sign would be that you see a bulge. Sometimes when you sit up, you see that bulge there, or you stand up, or you're going about your daily activity, and you start seeing a bulge coming up in your groin region, or bulge at the at the navel, the level of the navel. And yes, so that is the most common symptom. It's oftentimes if the person is obese or has fat, we don't want to use discriminatory words like fat, they have a high body mass index, you would may be more difficult to see that swelling.
But sometimes that content, just like how you could have a nerve that is pinched, is it possible for that content to get in an area where you have network of nerves and have it pinched and almost have you experiencing pain in a severe manner?
Okay, yes. Once the hernia or the opening is there and the contents pushes through into that opening, it can become pinched or squeezed because the opening is almost like a ring. And it can, if a lot of the content goes inside at the same time, it gets squeezed and pinched, and that will give you that sensation, that dull ache, that pinching sensation, that pain.
Is there any way to get that content back up without surgery?
Okay, as a person usually gets that increase in pain or that bulge when they're very active, they're doing certain activity, anything that increases the abdominal pressure, they decide they go to the gym and they want to lift some weight. So then they see that the hernia comes out, or so, as we say, pop out or comes out, and you see the bulge there and it becomes very painful. Oftentimes if that person relaxes, lie down, you will see children after they're playing and jumping, they'll say, "Mommy, my tummy is hurting," if they have a hernia at the navel. And then they'll go and relax, and oftentimes that reduces the pressure inside of the tummy, and the hernia slides right back in.
The content?
Yes,
Slide
the
back
hernia
to the
content.
hernia?
Yes, it slides right back into the defect.
Could we take a break, please?
Fellow citizens, near and far, join Newrish Nital on Sugar Soda 90.3 for Fear No Favor.
Where is man? Where is the cancer man? No runner come out for war.
Tune in to 90.3 on your FM dial. Log on to SugarCityFMSankits.com or download Simple Radio app on the Google Play Store. Enjoy Newrish Nital every Thursday night from 8 to 10 p.m. as Newrish Nital tackles the issues and take your call. Fear No Favor every Thursday night from 8 to 10 p.m. on Sugar City 90.3 FM.
Children's future dwindling, creating much disillusion. Or would we watch on idly, disregarding our self-sufficiency?
Welcome back to Fear No Favor with our General Surgeon, Natalie Osborne, Doctor. Now, Doc, what are some of the risk factors that can contribute to one getting hernia?
Okay, well, some of a hernia can first be classified in two main things. The abdominal wall hernias, it can be what we say congenital, which is that you're born with it, okay? Or it can be acquired, which means that it develops over time, okay? Sometimes most of the hernias over time develop, or what we call acquired. And that happens if a person is involved in a job that they do lots of heavy lifting or they stand for long hours. Some persons who are laborers, they are at increased risk. Some persons who work in an office but then go to the gym and lift heavy weights over a long period of time, they can develop a hernia. Some persons who have chronic illnesses like chronic lung diseases that causes them to cough quite a lot. Okay, and these persons are continuously coughing. Persons who are chronic smokers and they have this chronic cough, or persons who have allergies and they sneeze quite often, they can develop a hernia. Anything that you do that increase the pressure inside of the tummy, it would increase your chance of developing a hernia. If you have difficulty defecating and you're often forcing when you go to the bathroom to use the toilet to stool, you're pushing because you're constipated, the stool is hard, you can then develop a hernia. Over time, you are forcing, and that creates that can create a hernia there. Women who's had multiple pregnancy, every time you become pregnant, as the uterus, as the baby grows inside you, it is stretching the abdominal wall, and that can create a hernia. Or if you may have had a small hernia there, it can widen the opening or widen the defect. And if you've had any abdominal surgery, we said any surgery on the abdomen or the belly where you would have had a cut before, you can then have a hernia that results that we call an incisional hernia.
Is it possible for a person to have more than one hernia simultaneously?
Yes. Oftentimes we've seen patients with multiple hernias. We've seen patients with hernia at the navel, which we call the umbilical hernia, or they can have a hernia at the groin, which we call the inguinal hernia, and we've had to repair both at the same time, both simultaneously. And another thing, persons can have a hernia in one side of the groin next to the pubis region and then develop a hernia on the other side. And the patient would often come and say, "Doc, you fix the hernia here and then it come back over, it moved over to the other side." But that is not so, because it is two different structures on one side and the other. So you can have both hernias there simultaneously. And then once you repair one, the pressure is then more on the other side, so that one may become more prominent.
Sometimes you may see a person with a bump in that area, in the groin area, and they start to walk a bit wide, because I think they used to call them cannon. You're aware what they would call a cannon? It just takes on this sort of, maybe not as big as a table tennis ball, but reasonably sized that it can provide you some discomfort.
A cannon is not a hernia, but what we grew up calling a cannon is actually a lymph node that is at the groin region that becomes inflamed or swollen. Sometimes if you have a cut or any infection in the foot, because the lymphatic drainage or drains out if infection or the waste from down the lower limb, they pass through the groin or by the groin region, and if you have any infection there, those can become swollen. So those are lymph nodes, we call cannon when we were younger.
Your child may be more likely to born with what are some possible outcomes for persons who have hernias?
What are some possible?
Born prematurely.
Oh, those are what we call the congenital hernia. Oftentimes, if a baby is premature, that can lead to developmental issues, and that child can have a hernia, whether by the groin region, especially if it is a male, or if by the umbilical region. So oftentimes that can happen. If they have any sort of genetic abnormalities at the level of the connective tissues and stuff, they can develop these hernias.
You know, it is interesting. I'm seeing two words here. I'll be quite honest, at university, at times, they were a bit prejudiced towards us. Our color.
Okay.
And I can recall doing something on sickle cell anemia. And professors and some authorities, they were happy to hear that, because they considered it more of a black person disease than overall white and black. And then I went to do my research. I said, since they want to behave that way, I did my presentation on cystic fibrosis, which came out to be a disease that only affect white people. So when I see it here, it just massaged my memory back to that presentation that I made, cystic fibrosis. So when I'm seeing it here, I'm just wondering if it is just something that would affect everybody, but more so somebody of the white race and the black race.
Well, cystic fibrosis, we don't want to get off track and speak about another topic that our audience are not aware of what cystic fibrosis is. I don't think most of our listening audience would be aware. That is something, but that in the context of what we're talking about with the hernias, a person who has cystic fibrosis can, that infant or that newborn can have different types of hernias. I guess that is what you're referring to. But that's a different disease that affects the lungs that we could talk about in another day.
Have undescended testicles. That's when both of them could eventually stay up in some situations. You have ever seen that?
We've spoke about that earlier when you made reference to undescended testes, when you said a friend had one of his testes down in the sac and the other was not there. That can happen in instances where there is some abnormality in terms of development, and the infant, the testes are not inside the sac. They may be anywhere along the track from inside the tummy to the inguinal region.
What are some of the possible complications of hernias?
We spoke about a hernia being a defect at the umbilicus. So we know that we have that opening there, that defect. If that content that is inside the tummy goes through the opening and gets stuck inside, we say that is incarcerated. That's one of the terms. So it means that it is inside, like, for example, someone who is incarcerated or go to prison, they're trapped inside. So that hernia or that content gets trapped inside of the defect and it gets squeezed, we say that it becomes incarcerated or trapped. And if that continues, remains there for a long period of time, it can become more swollen, edematous, and then it can lead to other complications like strangulation, where we said that the blood supply is cut off to whatever organ or structure that is inside of the defect, and it can create quite a bit of problems. And for example, if that content or that structure inside of the opening or the defect is bowels, what we call the intestines is bowel, it can lead to an obstruction because it can close off the opening and the food content that is inside the bowels is not able to advance or progress.
But is it possible that the content that would have gone through the hernia become dead?
That over time, yes, if it stays in there and the blood supply is cut off, because any part of the living body that doesn't have adequate blood supply is going to eventually die. So it can become dead over time, creating quite a bit of chaos or quite a bit of complication in the patients. And that in that instance, it becomes more of a surgical emergency.
When should I worry about the pain from a hernia?
When should you worry about the pain from a hernia? That will depend. You are concerned if the pain is persistent or when you see the bulge. Most of the time a person will say, Doc, I have this hernia here and the hernia has been here for a while and it hasn't bothered me until recently. And oftentimes they'll say sometimes the hernia comes up or it is swollen and then it stays there for a while. So most of the times when it becomes painful, it is because it is incarcerated. As we said earlier, the content, it gets trapped inside of the opening and it gets stuck there and it is squeezed and pinched and it becomes very painful. And that's at that point some persons would want to seek medical attention because they're concerned about the pain. And if that pain worsens or then you have other symptoms, like you maybe start to vomit, you start to have fever, those are symptoms which will prompt someone to seek medical attention. And those are symptoms of great concern because it might be indicative of a complication, such as what we said earlier, like a strangulation, where there may be death to some of the content that is inside the hernia sac.
Sometimes you say a patient might indicate that the hernia was there, but it went. would a patient just know, or it would have had to be diagnosed first and they're aware of it? Because sometimes you see swelling, but you don't know what they are. So sometimes you might go to your doctor, they indicate to you that this is the situation, and it might have gone through some relapse, gone back down, and then come back up. Though, would a patient be able to say without experience that this is a hernia?
Well, our population is usually very bright. Persons that know have so much more access to information. So
Yes.
persons use the internet and they're always researching if they have a symptom. And persons often are quite familiar with what a hernia is. And sometimes they'll say, Doc, I have a hernia. They'll come out straight away because they've seen the bulge there over a period of time. They see the bulge disappear and reappear. Most of the times, a hernia is diagnosed simply by a physical examination, by seeing it. And it's quite common, so it's quite easy to observe. In the instant, if the patient is a bit obese, or they have a high body mass index, you may not be able to see the bulge quite clearly, and then you may want to do further checks, maybe do an ultrasound to help you with that diagnosis. But it's usually what we call a clinical diagnosis, so that you can just simply look at it by physical examination.
How is a hernia diagnosed?
So we said that by physical examination, looking at the hernia, and also by you can do an ultrasound to help confirm that diagnosis.
What is the treatment for a hernia? And all of them would have the same basically the same treatment?
Yes, a hernia, if a hernia is asymptomatic or the person doesn't have a symptom, but they see the bulge there from time to time and they're quite comfortable with it, that can be left there for a while. But most hernias ultimately needs to be repaired for it to be resolved, to be surgically repaired. So that would be ultimately be the treatment. The only exception is the hernia that develops at the navel. What happens at time? In a newborn baby that is born with a hernia, we said earlier that it was a congenital hernia, so you're born with it. Oftentimes that hernia, most of them close over time. So you may have your grandchild, and it's born with a hernia. And by the time the child gets to the age of 3, 4, 5, between 3 to 5, that hernia can close down spontaneously on its own without having it surgically repaired. Because oftentimes, if it is small enough, it can close. But many hernias would not close, and you may need to repair it. Why would you want to repair it? Because you're having some sort of symptom. We say that the person may have recurrent incarceration, and it becomes very painful, or you don't want to wait until it becomes strangulated. As we say, the blood supply is cut off. That makes it a surgical emergency, and that would need urgent or immediate surgical treatment.
You have some adults with some oversized navels. Could have been as a result of maybe a hernia in that area and content got out there and just stayed out there? You had some people with some real oversized navel, even as adult, real big. What is the situation there?
I like that.
Was it a hernia in the area?
But usually if you see their bulge or the navel looks big, because the navel should be big, it's usually a hernia that the person have there, or something that is there to make it bulge out or make it appear big. Because most persons should have a flat or by the navel, it's normally inside, or some people have a little bit of bump. But once it's big and oversized, it usually means that something there is abnormal. Many persons have hernias and just say, oh, it's not bothering me, I'm not going to interfere with it.
Yeah, because this person would have gone, we played soccer, some person take off the shirts, some would keep on, and we played shirts on, shirt off, again, shirts off. And we will see situations like that, some real big ones. And I just wonder if there was any situation where that could have been addressed, if they wanted it to be addressed. What happens if a hernia is left untreated?
If the hernia is left untreated, what happens? We said earlier, it can be serious, but oftentimes it is not. So our objective here is not to scare our audience, it's to inform them. So what happens if left untreated? You have to be aware of the fact that later on it can lead to a complication. But if you determine that you're not going to seek any surgical treatment, you will have to be careful. You want to avoid certain activities, the heavyweight lifting, things that would make your hernia bulge out more frequently. Those sort of activities that we spoke about, lifting weight, maybe gymming, things that may create that problem there. Because what would happen, it can go out and it can become incarcerated, or it goes out and it gets trapped and it becomes painful. So if you choose not to repair it, you just have to watch some of the measures and be cognizant of the fact that it can grow and become bigger, or the defect can become wider over time.
Is it possible for someone to have hernia repair and then experience a relapse?
Yes, it happens often enough that a person can have a recurrence. We call that a recurrence of the hernia. So, excellent question. You have the hernia, you get it fixed, and then over time you say, but doc, I had this fixed 3 years ago, 5 years ago, 10 years ago, and now it's back. And it can happen like any type of surgery. It can have a complication. You can have a weakness in the wall there. You could have had a technical difficulty if the patient was very obese. The patient might have been diabetic. They have something that makes them immunocompromised if they have kidney failure, or if the wound got infected too. Quite a few hernias can reoccur if there's been a severe infection at the site of the operation. So it can occur. It doesn't occur very often, but it can occur.
Could we take a break, please?
Fellow citizens, near and far, join Newrish Nital on Sugar City 90.3 for Fear No Favor.
Where is the cancer man who wanna come out for war?
Tune in to 90.3 on your FM dial. Log on to SugarCityFMSaintKitts.com or download Simple Radio app on the Google Play Store. And join Newrish Nital every Thursday night from 8 to 10 p.m. as Newrish Nital tackles the issues and take your call. Fear No Favor every Thursday night from 8 to 10 p.m. on Sugar City 90.3 FM.
Would you stand up and see your country dying and never lend a helping hand? Would you see your children's future dwindling, creating much disillusion? Or would we watch on idly, disregarding our self-sufficiency? Maladministration, wrecking all and no. I said no.
Welcome back to Fear No Favor. We're talking about hernias with our general surgeon, Dr. Natalie Osborne. And I really want to thank you. We haven't come to the end of the session, but I really want to thank you for taking time out. I know Thursdays are extremely busy, and the fact that you come here to share information with the general public, I think that this is something that we've been yearning for over the years. A lot of people go to doctors and they just don't know. They don't even know symptoms of certain things that are happening to them. And I think that this is very transformative for our cultural practices. A lot of guys, especially males, are afraid to go to doctors. And if they better understand and feel more comfortable, because when you don't have knowledge, within your mind you're speculating as to what's going on with me. I don't even have a clue. And sometimes there are some doctors who feel that it doesn't make any sense trying to explain to you because you won't understand the language. It's a bit beyond you. It's not the layman's language. And when a doctor can come out of that cage, so to speak, and put it in layman's term that they could understand, that we spoke about the Bamonko. That is what we knew it as in our cultural environment, but a lot of persons might not have been aware that you can get them in different areas as well. So I really want to thank you, and I like the effort you make to ensure that people understand. The next thing that we have to do on these days is to get people to understand how to describe the pain that they are feeling.
Oh, yes, yes.
That is a very awkward area. How the pain feel, and they struggle with it. So we need to get a little closer onto that, and I really appreciate that. So
many times today, as opposed to 50 years ago, it was that the doctor was seen as superior, and you went to the doctor and the doctor gave you something, and you just did what the doctor said without questioning. But as time has passed, information is much more widespread, and now we have to take more time to explain to persons, and persons are quite knowledgeable a lot about these terms. Many of the terms that I use here, I know we have audience who are quite familiar with some of these terms, because persons are always researching. If they have a particular disease or pathology, they're researching about it. So they come to the doctor quite knowledgeable, and oftentimes they're sitting there testing the doctor's knowledge in some way too, because they're aware what's going on and they want to see if the doctor is going to pick it up as well. So not like it today is unlike the days before. That's what I'm trying to say, and that it is important to educate persons so that they're aware what it is that they're dealing with.
But I am saying my admiration for you is that some doctors don't take it too lightly. They get offended because they feel that you're questioning the expertise. And we have to rise above that. We can't always assume that I did medicine, so only me and the other guys them under this category would understand what I'm saying. And you never do that. People researching. You have a lot of intelligent people who didn't get a chance to go off to university.
Yes.
And once they go and they acquire the knowledge on the computer, they're almost just as good as if they went somewhere. So we must not get offended if people start to ask questions. Because sometimes people come for a second opinion. You might not even be aware that they had a first one already.
Yes.
I can recall somebody went to a doctor and the doctor said, look, drinking alcohol is really destroying you slowly. And person couldn't stand that because it seemed as if he was addicted to the alcohol. So he went to a different doctor. And he asked the doctor if he can drink occasionally. Occasionally would suggest, well, you're easing off on something. And he went and he drank occasionally, not telling the doctor, the current doctor, that he wasn't supposed to drink at all. And he met his demise. So something you don't know who you're dealing with, and you can't take people for granted. And always try to explain. Nothing sweeter than a doctor who helps you to understand.
I oftentimes would take the computer, turn it to the patient and say, bring up an image on the screen to explain to the patient, so they're quite familiar with what they're dealing with. I'll say, let me show you, this is what we're attempting to do, or this is the planned procedure, so that they're familiar with what to expect.
Excellent, excellent. We crave for that in our society so badly. What are the possible side effects or complications of the treatment, though?
Well, the hernia can be repaired. We said that the hernia can be repaired with your own tissue, where you stitch the tissue using sutures or close off the opening, or sometimes we can use what we call a mesh, which is like a foreign body, a synthetic thing you put over the opening and you tack it in place so that the content or what's inside of the tummy would not push through anymore, and you can repair that. But there's certain side effects, especially if you use a mesh. It's a foreign body. It can have the body can reject it. Sometimes you could have erosion of the mesh. Sometimes the mesh can get displaced. The mesh can become infected as well, and you can have an open wound there. Sometimes you can have a recurrence. We spoke about that earlier. You have the hernia, and over a couple of months you see that it reoccur over time, maybe because the person may have not rested well enough after surgery. What if they were a laborer on a construction site and they had to go back to work maybe a month after and they're lifting heavy weight? That can create a problem. A person can have a recurrence of the hernia if they have a wound infection. A wound infection is another complication. And it can be as a reaction to the anesthesia as well. There are different things that can go along with the anesthesia. And we said if a person has any disease that makes them immunocompromised, that their body is weakened, that person can develop a recurrence of the hernia. So you could have those complications. So they're mostly associated. They could have a recurrence of the hernia. You could have a wound infection. You could have a rejection. Your body rejects the mesh if you use a mesh to repair the hernia.
What is the content of the mesh? Do they have different qualities? They're made from different stuff?
Yes, they're made from different stuff. They're mostly synthetic materials, the different types of plastic material and stuff. They're trying to make them as more natural as possible to simulate the body's natural tissue. But it's still a foreign object. It's still not your own tissue.
Okay. How should I take care of myself while living with a hernia?
So if you decide, because your doctor should give you all of the options when it comes to your hernia, if you decide not to repair the hernia, you would have to keep in mind that your hernia can become larger over time. As oftentimes you get older, your body's tissue weaken over time. And so that is where the men would have come over time having the bamanku, because they had a hernia since they were a child and it was never addressed. And over time it became larger and larger. So you have to be aware of that, okay? But you've got to prevent it from worsening. How can you do that? For a person who is obese, you may want to lose some weight, because that would help decrease the pressure or decrease the volume of the content or the stuff that is inside of your tummy, because there's a lot of fat inside of the tummy. Because if a person is obese, they're not only obese on the outside, they're obese on the inside. The tissues and organs become laden with more fat. So you can lose some weight. You want to avoid lifting heavy weights and stuff. Anything that could increase the pressure in your tummy, you want to avoid that.
Okay, and do we have these surgeries often? There are people presenting with them on regular or often basis?
The hernia repair is actually, in terms of elective or planned surgery, it is actually the most common planned surgery, where there's a difference if it's an emergency or planned surgery. So as an elective surgery, it is one of the most common surgery that is done worldwide. Quite often too, with good outcome, very little complication. The person, if it is done like in first world countries, you can do it laparoscopically or with minimal invasive equipment. So you're back to work in a couple of weeks. And it is one of the most frequently done procedures.
And interestingly, when we think about those weak areas, we're thinking about muscle tissue, soft cells. But I have seen 2 babies with, in the head area, where there were bulges, weak areas, and the bulge, I think over a period of 4 to 5 years, it disappeared.
Weak areas in the well, you know, where a
head,
baby is born, the skull is not hard enough, and there are different soft openings. We call them the
Right.
fontanellas, and you can have a complication in those areas. If a child have a hydrocephalus, they have fluid on the brain, extra fluid. You could have a bulge there, but for different reasons, you can have that.
Okay, well, 8:58, and we have reached.
How fast an hour flies by,
hitting
huh?
right
Yes.
on the spot. I think that we always want to leave with the audience symptoms and things that should raise a red flag as to the possibility, a real probability that there's a hernia, and they should. What do you say to the audience in terms of symptoms, and what should they do? Should they try to seek health care? Should they just ignore it? What should
You
they do? What
always
is your
want to seek
advice?
health care, of course. Anything that you're unsure of, We have so much access to healthcare. We have all the health centers here. We have the district clinics. No one on the island could tell me that they have no access to healthcare. So it's best to always seek a medical assistant and get an opinion of your physician, and they may have to refer you, if necessary, to a surgeon to get an opinion, to be evaluated, and determine what it is and how you want to move forward. Knowing that delaying or deferring having a repair of a hernia, it comes with certain associated complications. You can then have any of the complications that we spoke earlier about, that it becomes incarcerated or trapped. We also said that the blood supply can be injured, or whatever is that is inside the hernia content, which we call strangulated. You could have bowel obstruction as a result of having a hernia, meaning that there is blockage to the bowel. So these are some of the associated complications. Oftentimes, a person will just see a bulge in the area and they could have some dull pain or ache. It worsens over time if it becomes complicated. So the most important takeaway is that if you have a concern, you think that you may have a hernia, you can seek medical advice and then determine how you want to proceed with the diagnosis.
How long a surgical procedure to adjust a hernia might take, and would it lead to staying overnight at the hospital?
Mm-hmm. Excellent question in asking that, because most institutions now, if you're going to a first world country, it would be done by minimally invasive surgery. You need some small pinholes, small holes in the tummy, and you can go home immediately. Some persons, if they find that the hernia repair was a little bit more challenging, they may want to keep you overnight. We usually here we do open procedures, and the person is in the hospital for a day or two. It all depends how the person recovers, move around the following day or two. And so, yes, the hospital stay is usually top 2 or 3 days, but oftentimes in most countries and big centers, it's what we call an ambulatory procedure, where you come in, you get it done, and you go straight home.
Of course, with the precaution.
Of course,
with
precaution.
Not to put
yes.
any extra pressure in that area.
And with your pain meds and your antibiotics and stuff like that. Mm-hmm.
Well, I think that we did an excellent job on this hernia business, because a lot of people, they would be in a few gray areas, and I think tonight we were able to put them into distinct shades of black and white.
I'm surprised you didn't ask about people saying hernia is ripe, because we've heard that many a times, and some persons will come to me and say, "Doc, you think the hernia is ripe? You think it's ready?" Have you ever heard that expression?
I've heard it in relation to appendicitis.
Oh, no, but it's mostly said in referral to hernia. So the doctor I would clarify that, because persons would say, "Doc, when you think it's ready to cut, you think it's ripe?" But there's no such thing as being ripe. But I guess what persons are thinking, that if it's not hurting them, it is not ripe. But remember that the hernia is the opening or the defect that is there. And over time, if not treated, it becomes wider, it can become more problematic. So they would think that it's ripe when it begins to hurt.
Maybe it might even hurt before it starts to ripe. might hurt while it's green.
But I guess that's just like from the older generation. They'll speak about things being ripe like that. "Oh, no, it's not ripe. Leave it, man. It's not ripe," until it becomes very problematic. What you do not want is to present in the middle of the night with an incarcerated or complication as a result of your hernia and have to have an urgent surgery, emergency surgery. Because what? It's not the same when a surgery is planned and you go and repair the hernia under a calmer situation, or versus if it is an emergency and it's 2 o'clock in the middle of the night. It can lead to so much more complication. The risk of having a wound infection is increased there. The risk of having your hernia repair done in an emergency situation of recurring is increased as well too. Okay, so if you wait, you're dealing with certain complications and you're taking certain risk as well too. Certain chances.
Like we have doctors on call. If a surgeon has an emergency, are there nurses that are on call to come to the theater to assist? Or some of them would just say, "Man, taking the one today."
No, it doesn't work like that. Being in the healthcare is a call to service. You have to love what you do. And the nurses are on call. Because we're a smaller community, the on-call most times is what we call ambulatory. You come in as needs be. So we're not there seated at the hospital all night because the activity is not that much in a smaller community. So if we get a call and we say we have to go in and there is a procedure, the nurses that are on call would come in for who work in the operating room. They will come in and get the case ready and we'll proceed.
I've had some conversations about the improvement in the healthcare. Are we on a trajectory to take us down to Parkson for a surgery? Do they carry out surgeries at Parkson or Mary Charles Hospital?
No, currently no. We do not have the facilities at this current juncture to perform any surgery there. Okay.
Okay, just wanted to make sure. But the trajectory seems as if it might be taking us there in our accredited hospital to come. Well, we'll wait and see. And I'm very happy that we did tackle this particular topic and let people know that hernia could be in various different places, and most people sometimes refer to the content rather than the hernia itself, where the content made its way through to provide the bulking of the skin area. So I want to thank you very much again, very, very much again, and I'm absolutely certain that the general public would have relished an opportunity to learn more about hernia, and I hope when you leave here you do not get a call to tell you that it seems as if it's a hernia.
That someone has a hernia that's incarcerated.
But could you do anything in the interim and maybe put it off until in the morning? Is there any way you can say, well, offer them some painkillers, some antibiotics? And
Good question, because most, and we could talk about this another day. We could talk about what it means to have an urgent medical need, or emergent medical need, or something that is elective. When you spoke of that sort of treatment, that is more on the conservative side, because you could have a surgical treatment, you could have a medical treatment. So that often is done too, because if you give the patient some pain, something to relax them, some muscle relaxant, the hernia can relax it, and the content can slide right back in. If you manage the pain, the patient can become much more comfortable. Oftentimes, two persons can have a problem just because they're dehydrated, they've been vomiting, and stuff like that. Once the pressure on the inside of the tummy decreases, the content can slide right back in. And you may turn what could have been an urgent or emergent surgery into something you can plan and prepare the patient much more.
Is it possible? Is it possible for somebody not to feel pain, but the situation is getting worse, all because painkillers were given to that patient?
Of course, yes. And persons have different threshold for pain. So a person may be different. Their level of tolerance for pain is different from yours or mine. It all depends. And if it is, you're giving them some kind of painkiller or analgesics, as we say, you can mask the pain and mask the complication. It's like putting a Band-Aid over a problem, but you haven't really solved the problem.
And it could get worse.
Yes. So that's why most of the times you want to be sure of what your diagnosis is before you start treating it. And if you're sure and you say, for example, because we realize that we work with a small institution, a small healthcare staff. So the same nurse that has to come out at 3 o'clock for emergency is the same nurse that has to work at 7 o'clock. So if it is 4 or 5 in the morning, you can buy some time by making the patient more comfortable, give them some muscle relaxants, some painkillers, and we know that we're going to do it at 7 o'clock. Okay? But you just give them an interim of time where the person is much more comfortable until everyone comes in and you could get it done with a staff that is well rested. It's not the same as coming out at 3 o'clock and working versus coming out when you're much more rested.
I usually instruct my kids, when in doubt, stay out. If you're not absolutely certain what's going on, stay out. Is it the opposite with a surgeon? If you're in doubt, go in?
Oh, if when in doubt, go in, it's not absolutely, because because of the advance in technology, there are lots of stuff you can do to help assist you in making diagnosis, which we call the diagnostic test. So you may have an ultrasound, you may want to do an X-ray,
But
you can have
even
access
after
to
all of that, you're still in
wait,
doubt.
yeah, but if you think, because oftentimes in general surgery and any kind of surgical specialty, you may not have the absolute diagnosis, but you may know that something needs to be done. For example, we would have patient who comes in, and we can speak about this in the future, we call abdominal pain. You may not know exactly what is the cause of the pain, but you know this is a surgical emergency. And when you go in, you may find that you have a ruptured appendix. You may find that you have a ruptured ulcer that is ruptured. You may find that you have a blood vessel that has burst or an organ that has perforated. But you did not know exactly what was the problem, but you knew that there was a problem. And that's the difference.
So when in doubt, go in. You just can't.
No. But no, it's not so simple as saying when
I
in doubt.
understand.
But once
I understand
you think
you
that is a
perfectly,
surgical
right?
emergency, but you're unsure of exactly down to the detail what is the cause, because we can say it's a surgical abdomen, but I don't know exactly what is causing the surgical abdomen. So
with that doubt, you go in.
Okay, you want to win. You're not going to give up until you win.
Yeah, it just you prefer to go in and not to go in and things get worse.
Yes.
And maybe into the detriment of the patient.
Of course.
So someday
Because you do not want to sit on something and then something is detrimental.
Right,
Yeah, you
right,
don't want
exactly.
correct.
Well, I've gone overtime. I don't know if overtime you get time and a half or double. Saturday's time and a half, Sunday is double. I decided we'll stop at 9. It's now 9:10, so that's
okay.
10 minutes overtime. But we needed to get that there off our chest with respect to a better explanation. Put it into distinct shade of black and white, as I said, instead of leaving it as a grey area. But I want to thank you once again. And I know we shall meet up again 2 Thursdays from today. We don't have any...
By the grace of God.
By the grace of God. By the grace of God. Yes. So thank you very much, Dr. Osborne.
Thank you for having me.
You've been doing a great job. I've been getting reviews. People always find me to discuss issues. And of course, you would have been the topic of some conversation. And they seem to be extremely pleased with your work ethics. And they have confidence in coming to you. A lot of them,
thank you.
I would say, a lot of them said, if she was under the tutelage of Dr. Wilkinson, she can only be good at what she's doing.
Thank you for the vote of confidence. Thank you.
Thanks again.
Okay. Have a good night, everyone. Thanks for having me. Bye-bye.
We'll take a break, make our transition, and give the doctor the freedom to go and get some rest.
Fellow citizens, near and far, join Newrish Nital on Sugar Soda 90.3 for Fear No Favor.
Where is the dancer man who wanna come out for war?
Tune in to 90.3 on your FM dial. Log on to SugarCityFMSankits.com or download Simple Radio app on the Google Play Store. Join Newrish Nital every Thursday night from 8 to 10 p.m. as Newrish Nital tackles the issues and take your call. Fear No Favor. Every Thursday night from 8 to 10 p.m. on Sugar City 90.3 FM. fellow citizens, near and far. Join Newrish Nital on Sugar City 90.3 for Fear No Favor.
Where is the cancer man? No runner come out for war.
Tune in to 90.3 on your FM dial. Log on to SugarCityFMSankits.com or download Simple Radio app from the Google Play Store. And join Newrish Nital every Thursday night from 8 to 10 p.m. as Newrish Nital tackles the issues and take your call. Fear No Favor. Every Thursday night from 8 to 10 p.m. on Sugar City 90.3 FM.
Welcome back to Fear No Favor. Of course, this is a week of water, and I just feel like I should have a little contribution to make. I think we are talking about being more aggressive with respect to dealing with water, improving water condition, be more conservative, and that sort of stuff. And we just need to look at a few things. Now, we live in tropical environment. Almost every home would have water heater on their bath piping. And I think that is a way for water to be wasted, because you have to wait quite a while before the water becomes warm or even a little hotter. And that water that would have to pass through in the interim, that could well be a bucket or two of water. So we are wondering why our people would have just been glued to using hot water to bathe almost every single time, to the extent that some persons, when they are not using hot water and the cold water, it's like something sting them. They jump in, they jump out. Just let current go and you see what would happen. Some people just refuse to bathe unless they have hot water. So we have developed a culture where hot water is the in thing. And as such, we waste, imagine every single neighbor using hot water, and it would take about a bucket. You take about a bucket before it can really hit the sensors and come out warm or even a little hotter. That is a way that we waste a lot of water. Unfortunately, it is true. Some people will tell you that they haven't bathed in cold water for over 10 years, 5 years. And some people will tell you, as long as, you see when electricity goes, some of them don't mind the things in the fridge might just run down a little bit. The freezer might be a little more conservative. But the real issue is that they cannot get to heat the water to have a shower. You might be surprised. Current goes all there, because some people would never bathe. And that is an aspect that we have to look into. A serious, serious aspect if you want to be aggressive in terms of water conservation. Now, you would have listened to the news and you would have heard those persons with climate change indicating that they take the carbon dioxide from the atmosphere and have it incarcerated, locked away. Therefore, it will not get a chance to go into the atmosphere. So they locked away the carbon dioxide, capturing. They call it carbon dioxide or capturing. But that is good. But the downside of that, we have to think, what about the opposite side of that? Plants need carbon dioxide and water to make oxygen and glucose. So if you were to lock away quite a heavy volume of carbon dioxide, how would plants be able to make food? That's a sort of dilemma. Maybe there was a lot still available for the plants them to have your 6 carbon dioxide plus 6 water to give you 6 oxygen and your molecule of glucose. That is something we have to think about when we contemplate and structure and design things to lock away our carbon in the form of various carbon products. Now, it is the same way that we have been locking away water. And it might sound a bit awkward, but I want to explain it. We build some homes, and I understand the current administration, it is the intention of it to put down about 2,000 homes over a period of time. Now, if you are going to have these housing developments, and every yard has in a septic tank, a soakaway, you could see where the problem is. From the time the water goes into, leave the home environment and percolates downward into the soil, that water, like the same carbon dioxide capture that they are speaking about, that water is being locked away because it might have to travel a great distance downward and it will get absorbed by the clay soil, whatever type of soil you have based on the soil profile that is of that particular area. The water is being locked away. So we have to look at that too as water loss. You're losing water. You flush, you do whatever in the bathroom, it goes through your septic tank and whatever else, that water is lost. It's not like it's going into a well field and then eventually they'll put down some wells, and that is not happening. So every time there's a housing development and we construct all these septic tanks and soakaways, that is a way to lose water. We must start thinking about having water recycled. And I would like to suggest to the authorities, when you are constructing these homes and you have these home development areas, you must also put a central wastewater system. A central wastewater system. And have each home in the vicinity of that wastewater treatment plant hooked up. So you have pipes coming from every home going to that central wastewater treatment system. It might take 1 or 2, because it might be a bit difficult to get everything based on how the houses are dispersed. But I think that would be an excellent idea, because that water can go through that wastewater treatment system from primary, secondary to tertiary to quaternary treatment, and that water can be recycled. Some of you might be surprised when I say that when that water would have gone in, make contact with the system, when it comes out as effluent, and you put a glass of water from the tap and a glass of water from the treated one that went through the wastewater treatment process, you'll be surprised to know you cannot tell the difference. They look alike. And if you carry out tests on them, dissolved solid and everything else, you find that the water is just as drinkable. It will just be a matter of mindset why some persons might not want it to go through the tap system for them to consume. But once that, because we have a way of constructing plants and other stuff and not maintaining them. So sometimes maybe to be on the safe side, you might just take it to by tertiary treatment and you wash your cars, you do certain things with it, but it has been recycled. instead of letting it percolate downwards into the soil. So we can do that, and we capture and recycle water that we use in homes. That would be a big, big saving. You start out with a volume of several million gallons, and what? At the end of the day, you recycle most of that. Most of that. And you make sure that the treatment is up to date. You have two set of pipes in the event of anything, you don't get cross contamination. But we have to be positive. We must put in state-of-the-art piping and systems within this wastewater treatment plant so that we can get water that can be compared to our tap water. Let us suppose then that nobody would want to reuse that water as potable water. You can construct a car wash beside the wastewater treatment plant. And the water that comes out after chlorination and everything like that. And maybe you can use some activated charcoal, activated carbon, to remove the chlorine from it before you start washing people's vehicle with it, to avoid reaction with the chlorine depending on the strength of it in the chlorination chamber. And we can put people to work. You have a wastewater treatment plant, you have quite a number of persons will be working there. And then if you put up a car wash to utilize the effluent that will eventually come out, then you have a job for more people. So I believe in those housing developments, it is possible to put some centralized wastewater treatment system, have people hook up and have the water staying above the surface and to be reused and reused and reused. I think that is the way to go, because the system is not all that complex or complicated. You have an area where the water would leave the house and come into the plant area, the treatment plant. You call that the contact chamber. That is when you first make contact with the wastewater treatment system. Then you have a system of aeration where you have some diffusers, and you got to be very careful with the size of the holes in the pipes that you put in underneath in the aeration tank. The aeration tank is to mix and everything because of what you're dealing with. You don't want a stench to be coming there, so you need the aeration tank to have everything mixed together, air getting, oxygen getting, mix up everything. And once the size is okay, because if the size of the holes is too small, then you can have clogging. So you want to make sure you get a good, proficient, diffused system. And then the aeration would be great. Then from the aeration tank, it would go over into the digestive tank. The digester, they call it, where it will spend quite a while there. And the sludge is the solid, semi-solid, because I mix with water now. The sludge now, as it is aged, it will settle at the bottom. But if you allow it to get too old, gases and so would start, hydrogen sulfide and various other gases, carbon dioxide, would be a part of the sludge, and the sludge would resurface. In order to deal with the resurfacing of the sludge when it is in the digester, you have to get somebody to physically break it up so that whatever was on the top could sink back to the bottom. Then after it would have been there by the digestive tank for a period of time, you must now take it and waste it. You have something called wasting underneath of the digestive tank. The sludge that would have accumulated under there, they would come through. They would come through and go into an area they call the drying bed. So the sludge would come through, but you have to know when to waste sludge. It would have to have a certain texture associated with it, and that would give you an indication that it is time to waste that sludge. So underneath, the sludge would go into the drying bed, and the water on top, the supernatant on top, will go into the chlorination tank. So the sludge goes to the dryer. The water on top would go into the chlorination tank. While in the chlorination tank, the water would pass over, back and forth, over some chlorine tablets. Because you don't want to do something that would be used up too quickly, so you use chlorination tablets. And if you put in the chlorine and the sun comes up, it is photosensitive, so that chlorine could be destroyed. So you will have to use a lot. Or sometimes if you just put a system in place where the water would pass over the chlorine tablet, you just have to replace the chlorine tablet as it melts away, as the water will continually pass over it. Now that water, after being chlorinated, can be further treated for micro pathogens. Because the chlorine, yes, it could disinfect and everything else, but still you'd want to make sure that all is well. If you're going to put it back in people's home, especially for them to consume. But if you're going to use it like for washing cars or water in your garden and everything else, it is all right if you go from the chlorination tank directly to the areas where you want to use. But I said, like, if you're going to wash some vehicles, you might need to use some activated carbon so that you can get rid of the chlorine that is a part of it, so that you can carry out your function. Now, somebody may ask the question, what would you do with the sludge that you have in the drying bed? Like the terminology involves, is drying the water aspect from that sludge. The sludge is now a mixture of waste material and water. And it would dry out. The water would evaporate. It would dry out. And that dry sludge can be used as a low-grade fertilizer. You can now have it removed, mixed with plant material and everything else, and use it as a low-grade fertilizer. So there's nothing that would be wasted, and the water would be disinfected. It would be by chlorine, of course, or whatever other system they would have to use. And once you get that back into the system, can either be used for gardening purposes, or if you put up a little car wash beside, you can have the opportunity to do that. Or if you really do a great job with the effluent, it can go back to the housing system and be used whether to cook, to bathe, to drink, to put in your refrigerator. This is the extent to which technology would have been advanced so that you can actually reuse for human consumption water that would have gone through a wastewater treatment plant. We have to think about that. This locking up of our water in the ground, that is what we have to stop. We have to be more aggressive. Build less septic tanks and soakaways. Allow the water to go through wastewater treatment system. Have it treated properly up to the tertiary or quaternary level, and you can have that water reused. That water can be reused. And then they say that you have to spend thousands in order to save millions. I think that our water system, the piping, you could I heard them speaking about leakages in people's homes, the bathroom, dripping, and everything. Sometimes you see one drop and you feel it's just a drop, so you could ignore it. You put a bucket on it, like the gentleman said today when he was on the program with Cromwell. You could see that the bucket would get filled, and then you can use that water. But if you do not put a bucket, that same water, the same bucket of water would go somewhere else as being wasted water. But just like how we have leakages in and around the homes. The pipings that we would have put down long time ago. A major project would have to be carried out to have those pipings replaced, totally replaced. In some situation, it might be a bit rough, but you could try your best to replace most of what there. I know that they carry out a project in Newtown area where they were replacing all the asbestos pipes with PVC, polyvinyl chloride piping. And that was good, but I believe going up to our sources where the water would originate before distribution, I think that there are pipes along that trajectory, that pathway, that would need replacing as well. We need to have those pipings replaced because if you have leakage in those areas, a good amount of water could be lost. So we need to do a comprehensive. We say we want to be aggressive this year. That is the theme for World Water Day, our week. We need to also match our practical output with the ideas that we have. We just have to spend more time in the field correcting those possible leakages. And even though we are talking about leakages, we have to be careful because water would have been traveling in those pipings for quite a long time. Now, one time there was a discussion whether or not they should chlorinate the water at source and then have it come down to Lagweed area before you do the redistribution. Now, the issue with that is this. If you chlorinate early and the chlorinated water would have to travel miles to reach Lagweed, you would have had some sort of growth in those pipes. You would have had some sort of growth. Those growth that you have inside there can be reaction between chlorine and the organisms in those pipes. And when that happens, the end product or the byproduct could be carcinogenic, could cause cancer. Chlorine plus the growth in those pipes can create health problems for people. So it would not be wise to chlorinate at source and then have the water come down to Lagweed and then redistribute. It would be better, much improved, to chlorinate at Lagweed and have the water distributed after chlorination. Not chlorinate it up by source so that you don't have to carry out any chlorination at Lagweed because of the potential, the real probability that carcinogenic substances can be formed and go into the distribution to the eventual consumer. We have to be mindful of that. Very, 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 very mindful. Chlorine and those organic substances, carcinogenic byproducts. So we have to be mindful. So we need a comprehensive replacement of all piping for two reasons. There will be breakage and the water would leak. And two, there might have already been biological growth in some of these pipings. And if the intention is to chlorinate from source and transfer to Lagweed to be further distributed, that would be a bit difficult. We have to be a little more health conscious when dealing with water. We have to. So that is another area where we have to be aggressive. Some of us would have had bathrooms, toilet bowls installed long time ago. And it's not like the modern ones where you just have much less volume and will give you a clean flush. You have some from long time. And these could take quite a while to fill up. So what you could do is to take a bottle, I wouldn't say with sand, you could take a bottle, maybe even sand, and you close it and you put it inside of the tank itself. So when the water starts to come out, that sand would replace some of the water at the lower bottom part and cause it to rise to the detection level where it would shut off. If you, let us assume that you have 4 liters going into a tank and you put in a reasonably sized bottle with sand, that sand can displace, by the time you put in 2 liters, that sand can displace much of that 2 liters and let it reach the mark as if it was 4 liters inside of that tank. So you're creating a sort of artificial environment, very practical one, where the water would reach the mark for the valve to close off, even though not putting in the full 4 liters of water. And then you flush. So even though the low flush tanks would hold 2 liters, and yours that was in long time holding 4, by putting in the bottle with sand, you can be using the same volume of water as the 2 liter low flush tanks. By the sand in the bottle, the bottle with the sand displacing at least 2 liters of water and causing the valve to shut off earlier. And that is how we have to start being aggressive. You don't have the money to go and buy new bathroom facilities. You have to improvise. How can we effectuate certain things? We have to think it's science and technology. We have to think mathematics as well. Because you might have an object, like in science we teach students, and you ask them to find the volume of a stone, but the stone has an irregular structure. So with an irregular structure, there is no formula to find the volume of that stone. So what we have to do is put it in a container with water. And when you put it in the container, the mark would go higher. I mean that the stone would have displaced a certain volume of water. The volume of water that was displaced would be the volume of the stone. So if it was at 50 cm cube and it goes up to 60 cm cube by putting in the stone, you can quite confidently say the volume of the stone is 10 centimeter cube. So this is the same kind of concept that we use to get things done. I'm hoping that persons are listening and we can do what we have to do in a truly aggressive manner. The other area I want to look at is desalination. I heard somebody mention that she was in a conversation at some club meeting and someone indicated that the desalination plants would be bad for the environment. And we are thinking of ahead, so therefore we can plan. What she was saying is true to a certain extent, but it can be mitigated. I think that Cromwell would have indicated to her that when you put the salt water, the seawater, into the desalination plant, if you put in 100 gallons, you'll get 50 gallons of fresh water. And the other 50 gallons that remained would be very, very salty. You call it brine, B-R-I-N-E. Very, very concentrated solution of salt. Because if you take seawater and you take out the fresh part of it, so to speak, you'll be left with salt behind. And that is where the problem would really come from. And he indicated that if you have an outfall, meaning that whatever pipe you put into and connect it to the desalination plant to go back into the sea, if you carry it out sufficient, then it would diffuse because you have a lot of water out in the ocean. It would diffuse and the concentration of salt, that is that brine solution, might not impact the marine life. Now, there's an aspect of it that we have to be careful with. If you do not have an outfall to take it all the way out there and get it diffused before it starts to impact negatively or adversely the lives of marine environment, and you just drop it close to shore, you have fish living in that area, feeding in that area. And as much as the fishes would be accustomed to a salty environment, that super salt environment is not very healthy for them. So as a result of that, what they would do, they would change the feeding grounds and maybe the living environment, just change, go somewhere else. Because sometimes even if you try to put an outfall somewhere based on the dynamics of the sea, you could have the motion taking it down to a particular area, still concentrating that brine down in a particular area still. So you have to be mindful of the sea dynamics and the way the waves then would do this and the undercurrent and everything else to make sure that the marine life isn't impacted. Now, there is hope along that way. Even if you had a situation with the outfall, so the brine or very salt solution would not impact the marine life, and you can get that they're perfected, or the sea dynamics would still take it up and throw it somewhere or have it delivered somewhere to impact the marine life. There is a way out. Instead of having a pipe running from the desalination plant directly back to the seawater, the marine environment, what you can do, you can install or construct a series of what you call dilution ponds. So the brine now would have to go through maybe 4 dilution ponds, becoming more and more dilute as you move from first dilution pond to second dilution pond to third dilution pond to fourth dilution pond. And then after the fourth dilution pond is when you have the effluent re-entering the marine environment. So the dilution pond might make it even less salty than when it first came in. Remember when it first came in, the fishes were surviving in that salt concentration. So if you're taking it back to the environment after the desalination plant, that is much less concentrated after going through the dilution ponds, the marine environment would not really be impacted. And that is something that they have to think about, the dilution ponds. The brine solution that is coming out of the desalination plant before it goes back into the marine environment. You mentioned something that I wasn't quite 100% aware of in terms of the technology that they would have reached. I know one time if you put in 99 gallons of seawater in the desalination plant, it used to be only 33 gallons would come out. The other 66 gallons would be brine and have to be returned to the marine environment. But I understand him to say that if you put in 100, then 50%. So it seems as if there would have been an improvement in the ratio of fresh water that you can get from the desalinated water. So that's a good improvement, going from 1/3 to a half. So the equipment would have to do less work, but we have to understand too, desalination plants, they are heavy users of electricity. heavy, heavy, heavy users of electricity. So what you would want to do, because already we have an electrical supply issue. So what we would want to do is, while simultaneously, we must simultaneously put down the desalination plant. I understand is in the area of Connery where the soldiers and police officers usually would go to do the target training, shooting. And they would have to simultaneously put down a solar system down there to generate electricity. So the solar system would generate electricity, much of which is used in a desalination plant. So we have to tackle the problem simultaneously. Because if we put a desalination plant down there, and electricity would not be generated from a solar system design, that would take a lot away from the consumers' electrical supply. So we have to plan both. The solar system to provide the energy, the desalination plant, and then we take the strain off the electrical supply, and then we also take the strain that we're experiencing with the rainwater that we have been using. So I just wish my country well. They have persons of different expertise, and in the event that anybody sees it as wisdom to ask me a question, I would certainly be willing to entertain. We have to also remember some people talking about water running away freely. I think I heard the Honorable Congress Maynard indicated that as much as it looks like a lot of water, it is a very small percentage. And by the way, water running off of different places, you just can't capture that water and use it for human consumption. Maybe you can use it for something else. We have to be mindful that not every inch of water you see running away can be captured for human consumption, direct consumption, instead of like maybe being used in agriculture to feed animals, whatever. You understand? So we have to be rather careful. Very, 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 very careful. We must also be mindful that even if you're trying to dig wells, the soil profile of the area could be a challenge, because sometimes where you have clay soil, there's a tendency for a chemical named arsenic, a chemical element named arsenic, to be present. You know, it's amazing because I was looking at CNN last night, and a husband, a dentist, put arsenic in his wife's milkshake or smoothie. And he was even trying to bring in another more dangerous chemical. And they stopped him because they asked him what he wanted the other chemical to do. He said that he was carrying out some cranial, up by the head, cranial surgery, and he needed it to use. Anyhow, they didn't buy that, they didn't give him. But he would have already imported the arsenic, put it in his wife's smoothie, and basically that was the end of her. That was the end of her. So this is the same arsenic that we down here, based on our soil profile, can encounter if we are putting down wells. So we have to ensure that that level of human tolerance is not exceeded. because something you just cannot avoid certain things being a part of what you're trying to produce. But that tolerance level, that must be way, 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 way down. So it cannot impact. I think that was a problem up by Shadwell area, the well that they tried to put down up there. And usually when you have a well, you're looking around the same area. And if the soil profile is basically similar, then you might not have a well field, even if you put down that well. Because if the profile, different types of soil, the quantity, the percentage of each different type, if that is going to be in the vicinity where you put down the well, the first well fails, that means that area might have to be abandoned because you would have similar composition in the the soil profile to prevent you from even exploring any further. So we must be mindful. One thing I heard the water engineer said as well is that Bastia Valley Aquifer, that is an area where water will percolate down after rainfall over a period of time. And because the fresh water is less dense than the seawater, you basically have fresh water floating on the seawater. Floating. And whenever wells are dug there, you taking the fresh water off the salt water. However, if you take off too much, then the salt water could overpower the volume of fresh water you have on top, and thereby creating a situation of salt water intrusion. And when you have that intrusion, he indicated that it might take 20, 25, 30 years to have that problem remedied. That's a lot of years. So the last thing you want to have in the Bastia Valley Aquifer is saltwater intrusion. That's saltwater intrusion. And I think that he would have indicated that we are very close. The freshwater level is very close to being left alone before you could get saltwater intrusion. I think what happened a lot when they had that golf course over there before they put the salination plant and even before they put down that wastewater treatment plant, a lot of water used to come off of that aquifer to go and keep those grass over. And a lot of people don't like to hear me say it, but I will say it without fear nor favor. They used to use water off of Bastia Valley Aquifer in order to keep the grass green. And then, of course, they had the wastewater treatment system, and they have it sprinkling, knowing that the probability exists that you might have had pathogens. Just sprinkling. No concern for persons who might be in the environment or in the environment and pick up whatever there was to pick up. And then, when the wastewater treatment system wasn't sufficient to keep the grass green, they basically created a pond. A pond now with a thing at the bottom, a ceiling at the bottom. That means that you would have to put down a certain poundage of water in order to keep down the ceiling that they had at the bottom. Because there was no desalination plant as yet. What they used to do is something use the potable water and help to keep down the ceiling at the bottom, and maybe take some effluent from the wastewater treatment plant and put it up there. Even then, that wasn't sufficient to keep the water, the grass, green over in that area. A lot of us like to ask for golf courses, but we don't understand the demand they'll put on our water system. And then they went for the desalination plant. Right? So we have to be very mindful of our water. I don't want us to reach a stage where throughout an entire day, you turn on your tap and all you're getting is air. We must be more conservative. We must abide. We pay $20 for water. You can't say, well, it's me paying for it, so I do what I want with it. It's not a situation like that. You have to be more conscious, from a national perspective, and realize that despite the fact that you can pay for it, you ought not to have it wasted. Well, we have come to the end of yet another session, and I'm almost absolutely certain that we would have learned quite a bit from it. And I would like to thank you for those who listened. I see one or two messages on the phone. I will adjust them when I leave the studio and I'm home, take some time out to adjust them. And a special thank you to Ms. Thomas for carrying the board for us this evening. So all the best for the rest of what is left of today, and wish you well for a bright and hopeful tomorrow. Thank you.
And statements made by the host and participants in this program are not those of the owners,